Hi, my name is Dr. Stephanie Wise. I am one of the veterinarians and owners here at Lowell Animal Hospital. Today I'm going to be talking to you guys about heartworm disease, a little bit about it, symptoms, treatments, diagnosis, and prevention. So heartworm disease is something that we see very commonly in this area and throughout the entire United States. It's very common. If you come in for yearly preventative visits, you most likely have heard your veterinarian or the office staff talking about preventatives and heartworm testing. The reason for that is heartworm disease. We see it all across the area because it's transmitted by a mosquito. So the way that it works, the way that the life cycle of it works is dogs are the natural host for heartworms. And also our wild population, so foxes, coyotes, wolves, not really in this area, but the foxes and the coyotes are also hosts for it. What happens is you have these adult heartworms in their system, they mate and they produce offspring, which are the baby microfilaria or baby worms that we see in the bloodstream. And so when a mosquito comes and takes a blood meal from these animals, it goes into the mosquito's body and becomes the infective stage in about 2 weeks. So after it's sitting in the mosquito for 2 weeks, that mosquito then bites our cats or our dog friends. It transmits it into their bloodstream, which takes 6 months from when they're bitten until it becomes a mature worm in their heart. So if you take a heartworm test at your yearly visit, but you haven't been on preventative, it could be negative, and then 6 months later it could show positive since it doesn't come up for 6 months on a heartworm test. Symptoms of heartworm disease. The scary thing about heartworm disease is that majority of the patients are asymptomatic, meaning they don't show any symptoms for it. And so the only way to truly know is to take a heartworm test. Others can show varying degrees of symptoms, so a mild cough that's intermittent or kind of comes and goes. It could be persistent, you can have some weight loss, exercise intolerance. Those are the most common things that you see. Other patients could have severe infections with it or severe symptoms with it, and so things like that would be a severe persistent cough. You would have respiratory distress and sometimes sudden death, as these worms can break off and create what we call an emboli, which is a blood clot to the lungs. The biggest things is prevention. Prevention is key with heartworm disease. You can pretty much prevent their entire life, which is 1 pill a month or an injection every 6 months, and that costs less than a treatment of heartworm disease. Heartworm disease also can be fatal, and so it's something that prevention is much more safe and economical for your pet. It's something that we recommend with your yearly screening, and we recommend doing it once a month, every month. So if it's something that you have any questions about, please feel free to contact our clinic. We'd be happy to talk to you more in depth about that or give you any information about testing or prevention that you may have.